Hi, my name is Melissa Buffalo, your host for Inside CRCAIH, and today we are with Sara DeCoteau of the Sisseton, Wahpeton, Oyate. I'm going to ask her a few questions on her pilot grant. So welcome, Sara. And before we get started, let's give you a little brief bio about Sara. She is the Health Services Coordinator for Sisseton, Wahpeton, Oyate, and has worked in tribal health for 40 years. She was awarded a Bachelor of Arts in Human Services and the Management from the University of Minnesota Morris. Sara has represented the Great Plains area and tribe on regional and national work groups and collaborated on a number of research projects implemented on the Lake Traverse Reservation. In 2012, the Sisseton Wahpeton Oyate completed its first ever study, Cavity Free in 2013, which she managed. Currently, Sara is serving as the principal investigator on two studies, her CRCAIH pilot grant, Pregnancy Health Survey for Parents of Newborns on the Lake Traverse Reservation, and an EPI-AIDS collaboration with the Center for Disease Control and Prevention, Substance Use During Pregnancy Among American Indian Mothers. She serves as a member of the Sisseton Wahpeton Oyate Local Research Review Board. She is interested in efforts to develop Sisseton Wahpeton Oyate's capacity to collect and manage its data to improve programming. So again, I'm here to talk about your Pregnancy Health Survey for Parents of Newborns. So the first question, why did you choose this topic for your research?
We have a First 1,000 Days initiative. It's a forum. It's it's an interagency group that meets once a month, and we're interested in preventing adverse childhood experiences and mitigating toxic stress in children. And so we wanted to know more about what that is. And also we wanted to know what factors affect infant mortality. We have a very high infant mortality rate in South Dakota. For the American Indian population, it's 12.2 per 1,000 births, and for the white population, it's 5.1 per 1,000 births. So we wanted to know what factors make some pregnancies and some birth outcomes healthier than others. We're also interested in finding out what role dads play. So the Centers for Disease Control has an instrument. It's called the Pregnancy Risk Assessment Measurement System, or PRAMS. They've used that in just about every state in the nation, in New York City, and South Dakota has used it before. But dads have never been interviewed, and so we were interested in that. And also, we're very interested in the adverse childhood experience study. However, we didn't have any Sisseton Wahpeton specific information on what the extent of adverse childhood experiences are, whether they're the same as in other populations or more or less. We could only speculate on the extent of ACEs.
Okay. So what were some of the key findings from your outcomes?
Well, we found that our parents are making great choices. 48% of the mothers who used tobacco prior to pregnancy were able to quit either early in the pregnancy or during the pregnancy, and we found that the same was true with alcohol abuse. That mothers, when they find out that they're pregnant, are able to quit. We found that both our moms and dads are putting babies, are following safe sleep practices in putting babies on their backs to sleep. And we found that moms and dads are both agreeing that they're not allowing smoking around their newborns, around their infants, and that moms and dads agree on that topic.
Great. Just one more question before we end our interview. So, how could your findings be applied broadly or built upon?
Well, we want to improve programming for our parents, and we found in our study that there's that young parents experience a lot of stress, and but the dads are coming in with the moms for not only their prenatal exams, but also for well child exams afterwards. Yet the dads are not getting the services that the mothers are. So even though they're coming in with the moms, they're not being their blood pressures aren't being checked. They're not being sent in to see the dentist. They're not having their health histories taken. There's about half of our dads express that they are extremely anxious about the delivery, and there isn't any programming that addresses that. So services to dads would be one area. The other area is addressing depression. Mm-hmm. Moms that are depressed, where we found in our study that about 21% of the mothers were screened as having depression. And if we could offer services to that, we could improve the not only the birth outcomes, but the bonding with the mother and the mother's ability to be nurturing. When mothers are depressed, they're less likely to interact with their children and be nurturing towards them. Also, if the caregivers are depressed, so if dad is depressed, if grandma and grandpa, and even the early childhood workers are depressed, that all compounds it. And mental health in children is directly related to the mental health of their parent and caregiver.
Mm-hmm. Well, thank you so much for your time. And if you get a chance, please go to CRCAIH.org, where we will have her full presentation available on her pilot grant seminar series. So thank you, and we will see you on the next Inside CRCAIH.